Dr. Arlen Meyers. I'm the President and CEO of the Society of Physician Entrepreneurs, and thanks for joining us for this webinar. Our host and guest today are Usman, who is in Utah, and Damian, who is in Utah. And we're going to talk about finding a job in digital health. And just to tee this up a little bit, my view of this is that, it's too basic. There's the techies who are trying to find jobs in digital health, and they're physicians / techies with or without formal AI digital health credentials who are trying to find jobs in industry or in the vendor side. So it's kind of a 2x2 matrix, and people are trying to figure out where they want to play in the 4 boxes. So Damian will introduce himself, and Usman can chime in about sort of the tech perspective. And then I'll give you my 2 cents on the healthcare professional perspective. And then we're just open. And again, if you have a question or something you want to ask us, just ask it and we'll address it. So without further ado, Damian, thanks a lot for our co-hosting this with the Utah chapter and the Colorado chapter. So if you could tell us a little bit about yourself and then take it away.
Great. Thank you, Arlen, and thank you, Usman, for this invitation. Usman, I make you co-host so you can admit people, because I have
okay. Yeah, I was seeing those prompts. Okay.
Yeah. So if you can admit everyone so I can focus on the presentation, because I was admitting, and it's
sounds good.
I'm very excited about being here and having all this big audience this early, at least for me, in Utah. So I'm going to talk about our experience as a training program, how we are helping students. We have a lot of physicians, clinicians in general that are part of our program, and they are doing very exciting and interesting jobs. So let me share my screen so I can start sharing the kind of where we are. I will start introducing myself. My name is Damian Borbolla. I'm originally from Argentina. I'm a physician by training, but I've been working in informatics since before finishing the medical school, right? I started developing our own information system, homegrown information system in Argentina, and from there I worked in different organizations, even international organizations like PAHO and WHO, helping countries implementing and designing health information systems. So again, thank you for the invitation, and I would like to start sharing kind of part of our history, right? Our department was the first biomedical informatics department in the US, but probably in the world, right? And the founder was Homer Warner, that is also known as the father of informatics, and he started with the cath lab in one of the hospitals here in Salt Lake City, and by 1963, where the health system, the first electronic medical record that was implemented in the hospital, and then the creation of the department, the academic department that have been training informaticians since then. We have more than 500 graduates from the program that are now leading different informatics projects in the country and around the world, right? We have people that is working in different countries, so that's super exciting. Some of the things that our department created since 64, 63. So we are leaders in research and discovery in biomedical informatics, and now what we call digital health. It can also there is a lot of overlap and similarities with informatics. as we saw in one of the slides, one of the first electronic medical record, the health system, was developed here with a lot of insight and feedback from our faculty and people working in our department. One of the first AI systems that was using like a lot of what we know today as AI, the Iliad system was one of the early diagnosis systems developed here in our department too. As I mentioned, we have over 500 informaticians trained that now are leading different informatics projects around the world. One of the things that I have seen in the last couple of years is this change of paradigm, right? Like our department was like focusing a lot on like research and kind of innovation, and now there is like a strong need on the application, right? There's like more and more companies that are like seeing the need of having experts that can help in the analysis or in the design of clinical systems that can help providers or that can help patients to collect data and then use that data. Of course, with the advance, the implementation of electronic medical records, more and more hospitals are seeing the need of this type of professionals in their organizations. As I mentioned, there is like more and more companies that are seeing this need of having informatics or professional training in informatics, and not only physicians or clinicians like we were discussing at the beginning, but also professionals from like computer science background, like software developers and other areas of expertise. It's a great time to be in digital health or informatics. Alas, around 5 years ago, healthcare became the #1 industry, so it's the main employer in the US, passing the retail kind of industry. That doesn't mean that all like people is like working in informatics or digital kind of area, right? But that is saying something, right? There's it's like #1 like industry now in the US. And of course, with all the advances that we are seeing, AI, more power to analyze data, clinical data, the access to mobile devices, phones, right? Like patients can have their information in their phones. So there's a lot of potential, a lot of possibilities, and I think that's some of the reasons why I think it's a great time to be in digital health, in clinical informatics, in health informatics. This is what I just mentioned, right? Like healthcare is the largest employer in US currently. Some of the solutions that we can see, Apple is using FHIR, that is one of the technologies that was developed by like informaticians, right? Like standards a couple of years ago, and now like Apple is using that to get access to medical records, so every patient can access their record if they are stored in like, for example, MyChart, that is an electronic an EHR, electronic health record. Data, right? There is like genetic data. There is every day there is like more availability to get access and to kind of personalize treatment based on that genetic information. More and more clinical systems are integrated that data to those like EHRs and other clinical systems. Consumer or patient generated data. With COVID, we saw like an explosion on telemedicine, and so there's a lot of opportunities. And of course, like the knowledge-based information, the information that we are generating based on clinical research is growing, as we've been seeing in the last 50 years, right, like exponentially. So all this makes kind of the perfect storm to be in informatics, to be in digital health. And of course, if you're familiar with data science, this is kind of one of the quotes that I always share, that in this publication, this Harvard Business Review, they mention like data science as the sexiest job in the 21st century, right? That and if you're familiar with the industry, with the job opportunities, you know that if you are a data scientist, you will have a lot of job opportunities there. So how was our approach to how we are addressing this kind of change of paradigm, like going from the innovation or the research side to more the application, and helping companies to take advantage of like this workforce, these informaticians that are being trained in our and other programs too. We are not the only one that are providing this type of training, right? Like, but what we did around 6-7 years ago is like start collaborating, start creating partnerships with the different companies. Most of the companies at that time were local. Some of those companies were launched by graduates from our program, like for example 3M healthcare, but there's like many others that like starting like creating this type of partnership. And we created this industry advisory board where we kind of collaborate with these companies. Many of those companies, you can see them here, and we get like feedback from them, right, on the areas where we need to train our students. For example, the strong focus we have in data science is based on some of the feedback we received from these companies. They also offer practicum or internship opportunities, so our students can do part of the training in their companies, and it's a great kind of way of like getting familiar with the student getting to know the company, and in many cases those students ended up like working for those companies in those projects or others, right? Like, and we also organize networking events, and we have like one event every semester. Now with like since COVID that was kind of hard, but we've been doing like online and virtual events too. But in the past we have great events where we would like have dinner and opportunities to network between like our students and the companies, right? So these are some of the things we do, and I want to share. And we have a lot of information. I'm happy to share this presentation later. But I want to share two of the examples, two of the graduates of our program that now are doing great kind of work. One is you can see there is Yogesh Reddy. He's a physician. He's a physician that came to our program 4 years ago. He came from India. He ended up like doing a lot of data, kind of strong focus on data, and now he's working for a Highmark, that is a data focused company in healthcare. And Francine Stirling, that's another thing that I'm kind of happy to see. She was one of our student advisors, and now the student, one of the other students advisors we have in the program too. He also joined the program, right? So they are seeing how our students are succeeding in the field, and they want to join and become informaticians too. So she ended up like leading a group for Ancestry, that is a biotech company, and they are doing great. They are super happy, and we can see how like different background. Her background was more in management, was not like a clinical background, but we can see like with people with different backgrounds, more kind of technical or more computer science background or clinical background, can like succeed in like different areas in different type of companies that are more data focused, companies like health systems that are more clinical or healthcare oriented, and they can do great in any of them. So some of the example of like job opportunities that we've been seeing lately, again, there's like some that are like more biotech focus. Some of the new companies project running is we have 2 or 3 of our recent graduates that are working there. I don't know if you're familiar with Recursion, but it's a pharmaceuticals that is a local Salt Lake company that is doing great things with like drug discovery. Yesterday we have a presenter from that company in our seminar, and I'm kind of, it's super interesting what they are doing. Companies like Myriad Genetics, BioFire, Arab, those are also companies that started from the University of Utah and are doing more kind of genetic type of analysis and discovery of genetic testing or biomarkers for treatment too of some of the genetic or cancer, for example. Health systems are hiring a lot too, like in the traditional clinical informatics role, like the type of CMIO, chief informatics officers, but also like those type of leadership roles. But we are seeing more and more like on the data analysis, right? Like in the last 10 years, we've been seeing an increase on the adoption of electronic medical records, and now we have a lot of data, right? So those systems, health systems need data analysts. They need people that can help with the analysis, with the understanding of that data, and use that data to improve, right? Like the outcome of the patient, the outcome of the organizations. There is like data analytics. I group them like, I don't know, this is my thinking, right? But I don't know if these companies are considered like data analytics companies. Probably they call themselves something different, but like Health Catalyst, Collective Medical, those are companies that are doing great things too. And we have like graduates from our program that are working there. And of course, like the government, the public sector, right? Like the Utah Department of Health, especially with COVID, we have a lot of our students that ended up working there. Local Department of Health, like the Salt Lake County, there's like a big need of like those type of trained professionals, right? With the communication between testing, but between immunization records, between all that information sharing between the state level, the local level, the health systems, the CDC, right? All that communication was showing like the need for like trained informatician, trained professionals in digital health, in standards, in information exchange.
Okay, so how many more slides do you have?
I think this is the last one.
Oh, good. Okay, go ahead.
And I want to share, this is kind of, this is not something that is like at our organization level. This is something that the city, Salt Lake City, is created and is like pushing, is like promoting, that is called BioHive. And the idea is to make Salt Lake City, and they call it like Tech Lake City, to create like a hub, right? Because we have a strong industry, we have a lot of companies. We are the second in the nation on medical device. You can see the numbers there, right? But the idea is like not only have this kind of kind of hub that we have in our department, but to become more kind of a regional, right? More kind of at the city level, even at the state level, right? Collaborating with other biotech companies, and of course with the training programs like our program, but others too, like other universities that are training future informaticians, and collaborate and create kind of a space to help and promote this kind of sector in Utah, Salt Lake. And I think this is the last slide. Well, I have a couple more, but this is more related to what we're going to share, Arlen. So if you wanna,
yeah, let's do that.
For this.
All right, that was great. So if you could take your slides down, great. So we have a lot of stuff on the chat that I think we need to address. Tina, I think you have a good question. Tina Folletti, your question is about undergrads. So do you want to ask that?
Yes, good morning, everyone. So I'm a current senior and I'm about to graduate, but I'm also on the pre-med track. So I'm also in the process of working on my applications. And as a public health science student, I've been exposed to the tech side of healthcare in terms of epidemiology and health policy and services. So I was wondering what you would recommend for me to look into or apply to in terms of certifications or internships during my gap year.
Good question, and thanks for joining us. So we have a lot of folks on this call that have experience with this. Damian or Usman, let's try to keep the answer relatively short, but what would you suggest to Tina? So for undergrads, pre-meds, et cetera, a lot of these pre-meds are digital health people. I mean, they're data scientists. Some of them have created companies, and now they're applying to medical school. So it's kind of like a different mindset, which is a whole nother conversation. But to Tina's point, what should she do?
So I think, and I can speak from my kind of perspective, but of course, Usman and others, if you can chime in, feel free to do that. But I think if you are interested in working in informatics, you don't even need to do medical, finish your medical training. I think there's a lot of opportunities that you can do just with an informatics degree. There's a question about salary there that I can share too. Is salaries opportunities are great too. I think it depends on what is your interest, what is your passion, right? For example, my wife, she's a physician too, right? But she wanted to see patients. So, and she's an informatician. She did the same training that I did a couple of years ago, but she's interested in seeing patients. She missed that part, and she worked for a little bit in data kind of focus company, and she's great. She liked it, but she missed that part. So she ended up being a mix of practicing physician and doing research and doing using data, right? But she still sees patients because she needs that, right? I'm more interested in the kind of leadership and kind of the building and more the informatics side of things. So I didn't miss the seeing patients, so I'm not seeing patients. So I think it depends on what you're interested in but I would say if you are really passionate about informatics, about data, about improving health through information, through technology, maybe you don't need to do medical school, right? Maybe with your undergrad and a master program or some additional training, you can do great things change the health of patients, change the outcomes of populations, right? Just by the use of technology.
So Damian, we're hearing a lot about the Great Resignation, about how hard it is to find tech talent, how supply and demand, blah blah blah. So bottom line, what did a graduate of your program earn as a starting salary? Just give us an example. You're not an MD, not an informatician that graduated from your program, that the last one that got a job. Give us a number. What did they get paid?
Well, there is a big range, right? Like, but I can give you an example. Some of the companies, and I'm not gonna say the name, right? But one of the companies that was listed in one of the slides, and a recent graduate. So one of the students that graduated with a master degree. So he had an undergrad in computer science. He did our master and finished last spring. He was hired for one of those companies that the starting salary was 140, right? But then we have other companies. One of the companies was there too, that the starting salary is between 80 and 90. One of the health data analysis or data focus companies. And then we have others like more kind of, for example, the Utah Department of Health, and that's public. You can check yesterday I shared one opportunity on my LinkedIn, and they have the pay range there. But I would say those type of organizations pay, I don't know, between 60 and 70. So the range is kind of very different, right? Between the type of company and also the type of training you have. If you have more kind of data science and you can do machine learning, you can do deep learning type of work, now there is like the need for those type of professionals is
right.
really
and high. It really depends a lot on, on industry. I mean, we've heard stories of people right out of informatics programs, getting $200,000, they get a bonus, they get travel, they get stock, they get all kinds of stuff. So the bottom line is it depends. And I think, so what I want to do at this, and again, keep the questions coming, but I want to just briefly share my screen and talk from the physician perspective. So the question always is, how do I get a job? This is all very interesting and, credentials and background and blah, blah, blah. But how do I get a job? So here's I don't want to belabor, you all know the trends. You all know why we are pretty much talking about this. I need everybody to mute their mic, please. Thank you. So here are some of my observations from a physician entrepreneur, stuff that I do kind of perspective. The general observation is that people either want to get in or get out. People want to get into sick care because it's a $4 trillion industry. And there's a whole lot of other reasons why they want to get into it. There's a lot of people that want to get out of sick care and do something else, and tech is sort of the bright, shiny object. So they're either frustrated, they don't like medicine anymore, and so we really don't know the dropout rates. We do know the dropout rate for medical school. We do know the dropout rate for residency, but we really don't know the dropout rate for all these doctors that are saying, 20% of doctors are saying they're going to quit medicine in 5 years. I don't believe that. I think there are many, many reasons why that's not going to happen. But the fact is, there are some people that are going to drop out. So if they drop out, they don't want to practice clinical medicine, then they migrate to tech. So how do you do that? And obviously that's a personal decision, which is a whole nother subject. But at this stage of the game, I think the people listening to this call who are interested in dropping out of medicine, and I don't mean, I mean they're not going to see patients face to face anymore. I don't mean you're just going to entirely leave medicine and become a wealth manager or start a flower shop or a whatever. I'm saying you're going to participate in sick care, but you're not going to do it face to face. So you have a couple of options, and I call this persist, pivot, or punt. So you can just keep doing what you're doing, and the likelihood is you're going to be miserable. At some point in your life, you're going to say, whatever, I'm stuck in this. I have the golden handcuffs. I can't get out. I got debt, blah, blah, blah. The second is you could pivot and say, well, I want to pursue a different career. I want to stay in sick care. I want to help patients in some way, shape, or form, but I just don't want to do it face to face. Or you could punt. Like I said, you could just get out of medicine and do something else, or nothing. Just retire, play golf, whatever you want to do. But that's your choice. And again, all of these are separate conversations, and how do you make up your mind as to which one you're going to do? But if you decide to pivot, then here's what I call the six, actually there's six of them R's. So one is you start with reflection, and that basically is, who are you? What trips your trigger? What's your ikigai? What do you make? What's fun? Where do you want to work? Who do you want to work with? How do you want to work? What spot do you want to work in? Digital health, pharma, med tech, fintech, medical education, technology, you name it. So it's basically know thyself. So where are you right now? Are you happy? Are you grumpy? Are you dissatisfied? Are you sort of feeling the itch? That kind of thing. Step two, once you've done that, then step two is then you got to go out and do some research, because if you decide to pivot, just make the assumption that you don't know what you don't know. So you're going to have to sort of figure out, well, what's out there. And this webinar is a good example of people from all walks of life with different career experiences. And if you're smart, you'll connect to everyone on this call and reach out to them and ask them. So if you say, well, gee, I saw in the chat that you're so-and-so and so-and-so, what's that like? And ask them all the questions. It's an informational interview. This is where the value of networks comes in, and that's somewhat later on. But at this stage of the game, you're basically going to do informational interviews. Step three is then you have to figure out, well, okay, I think I want a job working for Google in digital health. Well, what's that mean? And what do I need to do to get that? So now you have to review your personal and professional development plan. And that basically means, what are the knowledge, skills, abilities, and competencies you need to make the transition? Of course, what you learn either as a technologist or as a physician or a healthcare professional, the skills are, some of the skills are transferable, but a lot of them are not. So you're going to have to sort of fill in the personal and professional development gaps and fill it in and make it happen. Then once you start doing that and you start filling in the blank spots, then you start to have to reach out, and that's where the value of networks come in. People like us on this call, like Arlen, who do you know? Like Usman, who do you know? Like the people that are entering the chat, who do you know? Who do you work for? Is there somebody I can contact? How do you open a door? How do you get the gatekeepers out of the way? Will you serve as my mentor? Will you serve as a sponsor? Will you help me kind of figure this out and connect the dots? And then once you figure out, okay, I sort of have a sense of who I need to connect to, who I need to talk to, whether it's on, the different job boards, whether it's on LinkedIn, whether it's on whomever, then you have to apply for the job, and you have to start applying for jobs and go through that process. And that, again, each of these steps is a lecture in and of itself. This is not going to happen overnight. It's going to take you, in some instances, actually several years to make this happen. All of us, or most of us on this call, have had education up the yin yang, and it's taken us many, many years to get where we are now. But you have to understand that at this point, you probably don't know what you don't know, and you're going to have to come down off the mountain to fill in the blank spots. So then you have to go out and apply for the jobs. And as I said, that's another course. And finally, if and when you get something, you're going to like it or you're not. So when you go out to these jobs, it's an experiment, and you're going to try it. It's just like dating. So you go run around, you kiss a bunch of frogs, you figure out which ones you like, where's your prince, and you know what you thought was going to work, it sounded like a good idea at the time, probably in many instances wasn't. And maybe you did it for 6 months, maybe you did it for 3 years, but now you realize you either really like it or you don't like it. Either way, you have to sort of recognize that you're not alone, that there are lots of folks that are sort of in this situation right now, and you need to report your findings. In other words, you need to share your experience and pass it forward like we're doing on this webinar. The only people that are going to take care of us are us. There is no corporate loyalty. There are very few organizations that are looking out for your interest and your educational opportunity. And we should appreciate the people on this call and the people that are trying to do this. But basically what I'm suggesting is that we need to rejoin the lost tribe of medicine, because everybody is sort of strung out. They feel alone. They feel isolated. They're not learning this stuff in medical school. They're not learning this stuff in residency. Medical associations are not teaching it. That's why we created the Society of Physician Entrepreneurs, to teach people how to do this and give them the networks, mentors, resources, whatever they need to make it work. So I'm going to stop there and go back to questions. So what are the questions? Either raise your hand or take off your mic and just tell us who you are and ask a question.
Well, they write the question. Let me comment on something that is about because I mentioned like job opportunities like in general, but if you're a physician, there is like a path for a specialty, a board certification on clinical informatics, especially if you're interested in a role of like CMIO, Chief Information or Informatics Officer. More and more health organizations are requiring that specialty or board certification that until 2022, until this year, you could do with a career path. If you had experience working in informatics and some formal training, you could get the board, that board certification. And those opportunities are like even pay higher, right? Like depending on the organization, but there's like on the 300,000 kind of salary range for a CMIO in some of the healthcare organizations.
Right. So a question was asked. So number one, please put your LinkedIn profile in the chat so everybody can connect to everybody else if they want to. Okay. This is about connecting dots. The only way this is going to work is if you reach out to people and connect the dots. You can't just send resumes. You can't just post stuff on job boards. It's about who you know. Absolutely. So please, does anybody disagree with that?
I sure don't.
Okay, so hearing no objection, everybody agrees. This is about who you know. So just connect the dots. Put your LinkedIn profile in this thing and then just reach out. If you don't reach out, it's worthless. So you have to kind of connect. Good. So I start seeing that. Thanks for doing that. Now, the question is, why don't medical schools teach this? And again, this is a very long lecture, but the short answer is actually several medical schools, including new medical schools, are beginning to understand that data literacy, data intelligence, data-driven organizations, artificial intelligence, all the stuff we're talking about are part and parcel of being a contemporary physician. So they are beginning, and I don't want to preach from the podium, but myself and others like me are involved in, and some people on this call are involved in educational initiatives to teach this stuff. And in fact, one of my students is on this call in an ex-MBA HA program that I teach in. I taught this last semester at the University of Colorado to a first-year medical student class. By this, I mean healthcare innovation and entrepreneurship, including a module on data science and data literacy. So the short answer is, little by little, there are cracks in the armor. There are 200 medical schools in the United States, including allopathic and osteopathic schools. The vast majority of them do not teach this. And there are many, many reasons for it. The primary reasons we hear are, we have enough to teach and we can't fit this stuff in. So where would you expect us to put it in the curriculum? And the second objection I usually get is, you know, being a doctor is about passing tests. Like it or not, you have to pass a test. You have to pass part 1, you have to pass part 2, you have to pass part 3. And if you don't pass the test, you don't get to be a doctor. So while this is all good, and it's all technical, some people consider it touchy-feely stuff, we just have to make sure that, could you please mute your microphone? Please, mute your microphone. Thank you. That we have to be sure that our students pass the test. And if we teach this stuff, it's not on the test. So it gets in the way of teaching the stuff that is on the test. So it's this ambidextrous medical school concept. How do you keep the heat, light, and electricities on to maintain accreditation and, in fact, make sure your medical students pass the tests while at the same time lead and teach stuff that will eventually be on the test? That's the challenge. And that's what we're doing. So that has to be bottom up. And to the pre-meds, and to Tina's point, and to the pre-meds, they are not tolerating us not doing this. So if you don't do it as a medical school, you are giving up a sustainable competitive advantage. Medical schools, medical students, and pre-meds will not put up with this. They're not. They're rebelling. They're saying, look, if you don't teach this to me, I'm going somewhere else that does. I call this whole thing academia. There's an incredible resistance to change, and we just have to get over it. Any other comments?
Yeah, quick points on what you said, Arlen and Damian. Transition largely depends on the stage of career that you're in right now, and also the location, geographical location. There was also a question about it. So I think if for example, we have something called bench to bedside competition here at School of Medicine. I regularly attend their meetings and meet with the different med school students. So I always advise them to get involved or volunteer with any startups and health tech startup. And there are a number of them in Salt Lake City. Salt Lake City is becoming a bio epicenter, so to speak. We have a biohive. And those of you in Denver and Arlen, it will interest you. Tammy Dorr was here last week, who worked with the Mayor Hancock in Denver and created the Denver Startup Week. So they are collaborating on something big in biotech space here right now. So I see a huge potential in terms of jobs, in terms of gaining skills, getting involved there. And and also I think you have to develop certain hard skills as a physician. It's always good to have some leadership qualities and stuff like that. But I know when I started coding, it was a miserable experience. But you have to get some, machine learning experience if you want to go into machine learning. If you want to go down the route of interoperability advisor, you have to have some file experience and stuff like that. So I think you do need to get some technical skills. And it's not all hunky-dory at the end of the day. You have to see what you want to do at the end of the day. A lot of people glamorize these things, but it's not that simple. So, just these little things.
Good. So we have a question from Higher Ed Success. Could you tell us your name, please?
Yes, this is Preeti Tanwar, and I don't have a question. I guess I have a comment because I'm an employer myself. So it is not just the programming aspect of it. There's a digitization entire after post-pandemic. So just an introduction. I own a consulting firm and we serve colleges and universities in a niche area of analytics process automation. It is not always the developers we need. In fact, we need the business analysis and all. So the digitization, process automation, analytics side. In fact, it is great if somebody is from healthcare domain and they want to be the project manager or the business analyst or in just the identifying from the QA perspective. There's so many roles. So the first point is which role would be most apt for you, depending on your personality, your strengths, and where you want to focus your energies in. That is also one of the first point I would highly recommend. And doing not just the courses, I guess we don't really care how many courses you have done. We mostly hire based on how many projects you have done and real-time experience you got. So anyone here more than welcome to apply to our ambassador program. I'll be happy to help.
Okay, so did you put your LinkedIn thing or where they can get in touch with you in the chat?
Yes, I did.
All right, good. So let me just address 2 points she mentioned. Thanks for that. One is, as we mentioned, you have to figure out what I call your roles, holes, and goals. What role do you want to play? What problem do you want to solve? What problem do you want to solve? And what are your personal and professional goals? That is the first question you need to ask yourself. And that's not going to be something you do overnight on a legal pad. It takes a while to sort of figure this out and experiment and what have you done that you liked in the past and that kind of stuff. So I think that's very important. The second point is, to her point of courses, that's old news. Taking courses and particularly rote memorization, the way most of us went through medical school, educational technology has radically changed. The market has radically changed. How and what we teach has radically changed. And to her point, that's why we're incorporating project-based learning, internships, co-ops, sabbaticals, you name it, to give people project-based outcomes measurable experience so employers can see what they did. It's not about what you know. It's about what you did and who you know. So we are beginning to make that transition. And in medical schools, we're seeing a lot more project-based learning. We're seeing a lot more what are called learning pods, where it's interprofessional and transdisciplinary in medical school. So the good news is we are beginning to see cracks in the armor. We are beginning to see the next revolution in medical and informatics education 120 something years after the Flexner report. It's taken a little while, but we're getting there. Other questions?
Just Laura that has her hand.
Yeah, thank you. I do have a question. I just actually something that is connected to what you just said and related to a question I posted in the chat before. Is like, how can, I mean, it's a question maybe for my past self, because I did that kind of already, but also for my future self to know how I can do this better. It's like, how can we transition from these like knowledge-based roles to the strategic roles? Because just to tell you a little bit more about my background, I did work in a startup in digital health, and now I do a PhD in digital health. But it's really hard, from my experience, to convince employers that physicians can be strategic about healthcare. And for example, for a role about product vision or really like more strategic roles, it's really difficult because they most of the time will go for a business person rather than giving the opportunity for someone that knows the business from the inside out. So do you have any suggestion of how to do this transition?
Yeah, I do. I have a bunch of ideas, but I've been monopolizing time. So what are some ideas from the group? Why don't we like crowdsource the idea for Laura? Give us one idea. How does she find somebody who has an entrepreneurial corporate mindset?
Maybe Usman can chime in. He has a similar background. He's doing a PhD too. And
yeah, Usman, your thought?
Yeah, so I think, like in my experience, I previously worked for a company, health IT company, as a product manager, and I was dealing with 2 or 3 product lines at the time. I had a couple of data science teams under my management, and we were dealing with mobile and web developers. So it's always good to have some, technical knowledge, even in order to deal with these kind of projects. So I would just say that, define your objective. What do you want to do? Are you approaching a leadership position solely as a physician, executive, or you are trying to step up the ladder of digital entrepreneurship or digital skills? So I would say that shine in the digital skill set as well, and work on them. Get some project management experience, like a previous speaker said, or product management experience, and build some projects on yourself by yourself. And then I think employers are always open to have someone from interdisciplinary background on their team. That's my experience. So if anyone has some other experience, I have an MD as well, so I'm a clinician by background, by the way. So yeah.
Employers are desperate. They are hiring. I never seen like this kind of pace, this kind of level of like desperation. Like I get emails all the time. It's like,
right.
And our students like get hired like even like first semester of starting the program. So I don't think like finding a job would be an issue. I think what you need to do is like find your niche, find where you're really passionate about, because you will be working on that, right? The
Yeah.
rest. So, well, you can always change, right? But I think like finding that kind of passion, there's like so many areas where you can work in informatics. If you are interested in like design, in like more the creativity side of like digital health, there is opportunities for design. If you're interested in more the technical, the programming, data analysis, there is opportunities. There are leadership positions. There is like plenty of those too. So I think it depends on what you're interested in.
Juan, do you have a question? Then we'll get to Rafael. Juan?
Yes, thank you, Doctor. Well, right now I'm doing a master in medical bioinformatics at Columbia, but I agree with Laura. Sometimes it's getting hard how to convince to people with work with data, especially healthcare personnel. Yeah, we have different backgrounds, and when I start to talk about data, they don't really like a lot and say, no, it's not the time, no, the data is not important. So sometimes could be a little bit harder. So how we can achieve the compound or goal with data management, with biomedical informatics in a research, entrepreneurial, and business context.
Good. I want to mention just a couple of things. I put a lot of stuff in the chat, and there are other resources after this conversation that you could take advantage of to take the next steps. The things I would mention are the American Board of Artificial Intelligence and Medicine, the MI Society, the Medical Intelligence Society. These are not-for-profits that are free. We have a healthcare artificial intelligence LinkedIn group. AI Med is an international events and conference planning event. The next one's going to be in San Francisco in May, and there'll probably be about 700 to 750 data scientists, physicians, entrepreneurs, investors, ecosystem, blah, blah, blah. That's a really good place to connect. So there's lots and lots of stuff. And then we have our physician career strategy group at mi10.ai. And if you want to sort of really get into the weeds in all of these topics, that's another place to follow up. So thanks for that. So Rafael, you want to guess your question?
Yes, the question that I put in the chat is about Epic. The Epic system looks like they are dominant in this area for physician informaticists. And it's kind of hard to break into it because they have like groups and they don't sometimes allow others to integrate, even though I went through physicians actually build their courses and everything else. It becomes very hard because they are attached to salary supports and so forth. So just Dr. Borbolla, you mentioned that there are several opportunities, but where I work, I mean, I see the opportunities are very skewed towards this particular software provider.
Yeah, Epic is kind of the #1 electronic medical record. Most of the healthcare organizations, especially academic centers, big centers, are implementing Epic, but now there is a requirement, like federal requirements, to make those systems interoperable. So, for example, we have an initiative in our group where we are building digital platforms, apps that can be integrated into Epic and others EHRs, and is using the same framework that we saw on the Apple phones, like the FHIR framework, the FHIR specification. So you can like plug those apps into Epic, right? That's opening like a whole new kind of area for innovation, because so what is hard now is like do innovation in the digital health, especially in the EHR side of things, when you don't have access to the electronic medical record, right? When the physicians are using like systems that those organizations are implemented. So now with this kind of framework that is called FHIR, but it's like spelled as FHIR. There is like an opportunity, or Smart on FHIR 2 is another kind of framework, there's opportunities for innovation there, right? Where you can integrate these apps into these electronic medical records, and also on patient-facing apps, you can integrate it into like the MyChart and other patient portals using the same framework. So those are tools, those are technologies that are important to follow if you're interested in the innovation in that area.
The other point I put in the chat is don't confine yourself to the United States, although it's the largest med tech market in the world. I mean, given remote work, given COVID, given the opportunities, and given the unfortunate reality in Ukraine, as an example, there are all kinds of digital health. I mean, the Ukraine has a huge digital health employment base. And unfortunately, until recently, now they're hiding. I mean, they're just trying to survive. So those opportunities, it's an unfortunate opportunity that has resulted from all that. But with every challenge, there's opportunity. And as evidenced by this call, we're seeing a lot of people in South America, Asia, Africa, developing nations, remote work. I mean, this stuff is all over the world. So again, and particularly if you have second or third or fourth language ability. I mean, there are folks on this call that probably speak, in the aggregate, like 10 different languages. So you can just figure this stuff, whether it's Pakistan or Colombia or Argentina or Asia or whatever, particularly Australia, they have a pretty powerful analytics and AI infrastructure over there. So there are all kinds of places to look. And again, this is about connecting dots. It's just who you know. And just reach out to these folks and give it your best shot.
And also, if your employer sponsors you, you can go for a training, Epic training, and train yourself in modules like Caboodle or Cogito if you want to work in a data science. And if you're a physician, you can get physician builder certification. So that'll also help. And if you similarly, Cerner is having a huge problem integrating. In fact, VA is having a huge problem integrating Cerner right now. So they are looking for Cerner resources as well. So. Yeah. Right. Just do your research.
But when we try to apply for those positions for Caboodle or to get trained, in my system, you have to be handpicked to be to go to those trainings.
You have to be sponsored by your employer, and they will send you on your behalf, and they'll pay. It's like $400 a week, so it's not that cheap for 3 to 5 weeks. I plan to do it, but pretty soon. But you can do your research, and they have people in place that can help you out as well.
Right. So my view is that these cartels in monopoly, like Epic and Cerner, they're going to be history in the future because they're arrogant and because they don't see what's coming. So if you're smart and you want to do, I mean, instead of becoming part of Epic, you want to make Epic obsolete. And that means you have to be a digital health entrepreneur. Now that's not easy. But that's why we're talking about this stuff. I mean, nobody likes Epic. It burns people out. It's a total pain in the ass. It has nothing to do with taking care of patients. It's a billing platform. So we have to remove it. We can't let them do this. So we have to push back. And that's what medical school education, that's what this conversation in part is about. It's not just about getting a job. It's about creating the future of medicine, restoring the joy of medicine, recreating the tribe of medicine, removing the barriers to implementation and dissemination of innovation. This is a much bigger conversation. And the only folks that are going to do it are the people on this call. Other questions? We have 1 more minute. Okay.
This is such a expansive topic that we can discuss it for hours,
Right.
Yeah, feel free to reach out to us, if you want any help. I'll be at HIMSS in a couple of weeks' time, and then I'll also be at AI Med in San Francisco in May. So yeah, feel free to connect and yeah.
Okay. Well, I hope you found this interesting and what's more inspirational, and that you just won't hang up and say, gee, that was interesting, and do nothing. So please go out and do something, even if it's wrong and you make a mistake. Just learn from it and move on. So we appreciate the input from everybody. Damian and Usman, thanks again for putting all this together. Like I said,
Sure.
This is being recorded, so we'll upload it to the SoPE YouTube channel so that you can review it or share it. And have a good day, and we'll see you at the next webinar. Bye.
All right. Thanks, everyone.
Thank you, everyone.
Have a good
Bye.
day.